At Griffith University, one of the other key elements that we've been pioneers in is what we call interprofessional learning, sometimes called interdisciplinary learning. The notion of interprofessional really differs a little from interdisciplinary learning though. Interdisciplinary means, for example, that perhaps our biomedical science students work with psychology students or work with art students and humanities and gain a very broad education. And our biomedical science program actually does that. We have incorporated humanities subjects into the third year of our biomedical science program just to give that rounded education. And there's good evidence to show that graduates who have a humanities background within a biomedical science degree come out as much more empathetic and compassionate educators and physicians if they go into medicine, for example. Interprofessional learning is slightly different. What that means is that in hospitals and working in the clinical areas, decisions are never made by a single person around someone's health generally. In a GP clinic, most of the time, yes, your GP will make a decision about you, but quite often they have to refer to others. They refer to a pathologist. They take a pathology test and that has a discussion. They refer you to a radiologist. They refer you to a specialist. And so already you can see that the need to communicate and work with others within medicine is important. In other contexts, you may be working with social workers, you may be working with nursing staff or midwifery staff, you may be working with exercise physiologists or with pathologists. And so the notion of interprofessional learning is that we start very early in your programs at Griffith in getting groups of students from these different disciplines to start working together on problems and understanding how as a team you make much better clinical decisions through this interprofessional approach than by a single master physician trying to control all of the decisions. This ensures that the health setting is much improved, the responsibility is distributed, but it ensures that you have much better health decision making at the end.